everyone. We are very happy to get a very interesting and a very pertinent topic today that most of us do not know about it. Most of us have overlooked it, and that is the medical legal aspects of the homeopathic practice. For this, we have Dr. Hitesh Bhatt. Dr. Hitesh Bhatt has been known to me for quite some time now through his family, and moreover, I got to know him when I faced a situation in the practice, and I had to just call him up and ask him, what do I do about this? And we will share about this experience little later. And he was kind enough to give me very good advice. So, to know a little bit about Dr. Bhatt, Dr. Bhatt is for last 25 years. He's a gynecologist, now a medical legal expert for the last 25 years, practicing in Andheri at Mumbai. He's a medical legal consultant at various hospitals, especially the Wadia Maternity Hospital in Mumbai, the Central Railway Hospital in Mumbai. And he's a partner in the legal firm called BNS Medical Legal Consultancies. He has been a chairperson in the Ethics and Medical Legal Committee of FOXY, and he also, as you can see in the background, the Be Safe indemnity insurance is what he advises people, practitioners, to keep themselves safe in case of a situation where there are medical legal issues in the practice. And he has been delivering over nearly 2,000 talks on this topic. And he has been consulting at various hospitals for medical legal problems for the doctors and helping them navigate through this very difficult and delicate area. And interestingly, he is a life member of the Film Writers Association in Mumbai. And so, welcome, Dr. Bhatt. Wonderful to have you here. And we would like to really know what you really are doing, because most of us wouldn't even understand what is a medical legal consultant.
Uh, so thank you very much for inviting me here and introduce me to a totally new group of friends.
Yes.
So, sir, my journey started as a gynecologist. I was a gynec. I had practiced as gynec, but I had passion for law. I did my LLB during the my journey as a gynecologist. Then medical legal started. Medical legal cases started increasing, and I thought there is a need for the in this area. I started working. I started auditing the hospitals. In audit, we check the documents, we check the licenses, we check all such things which can lead to problem or which will not allow doctor to win the case even if they are right, because document is the only thing which will save you in any legal battle anywhere. So I started doing that. That is the audit work I started, and gradually I felt that there is a need to go to court as well. So I gave back my medical council registration, and since 10 years I am working as full-fledged advocate plus the audits which I am doing. So I have become now advocate. Now there is nothing like medical legal. Let me tell you that it is actually, we doctors have habit of creating such words. So we have created that word. It is actually a law which is applicable to doctor.
Okay.
Law is applicable to journalists, law is applicable to lawyers, law is applicable to politicians, but we don't call political legal or journalist or legal, engineer or legal. Such words are not there. Only doctors have created this word medical legal. Actually, it is law applicable to doctors. So I started practicing in this field, and I am helping colleagues, and I am defending doctors at various courts.
Right. So we also feel that this is the need of an hour even for a homeopath, because that's where I will share my experience when I called up Hitesh Bhai. So there was this patient patient who was taking my treatment for quite some time, and that patient would get better and then intermittently not get better. And then at one point of time, the patient was so frustrated with it that they came and threatened me that I am going to make sure that we are going to get rid of this patient.
Munjal sir, we lost you.
Yeah. Hello.
I think we lost his connection.
Yeah, Munjal sir's.
We'll have to wait.
Somebody have to call him. Ah.
He'll just log in once the connection is restored.
Hmm.
Problem is, if I call him, I'll get logged out and I'll not be able to manage people.
Okay, I will just make a call to him. He might not be knowing.
Yes, sir. Today his Wi-Fi got disconnected. He will log in a couple of minutes.
He may use hotspot of his phone.
Yes, yes, sir. He's using hotspot now. It will take a couple of minutes.
Okay. So there was some glitch with the internet connection, and I'm back. So sorry about this. Yes, so that's where I left, and over to Hitesh Bhai.
Hmm.
Sir, if you
So,
could just repeat that because we could only hear till the patient came to you and threatened you.
yeah. So the only thing that I could really do, because this was something completely foreign to me, and never had I faced or even imagined that this would happen to me. So the first thing was to give a call to Hitesh Bhai and seek his advice. And he told me to buy this indemnity insurance. And I will now hand over to him what this indemnity insurance is, what is the importance, and why it would be so important even for a homeopath to buy it.
So, sir, let us start with the basics of the law. Now, in law, see, first of all, we have to understand that we are living in a society which is now non-forgiving. And people are as such frustrated. People are as such having very low threshold for anything that happens to their life. They are fighting in between the siblings, they are fighting with the parents, they are fighting with the neighbors, they are fighting with the spouses. So you are no excuse. They will definitely come and fight with you if at all you are not falling in place with them, or you are not giving the expected results. So that is the society we are living in. Now, if there is a dispute, there are mainly two segments where the complaint can be filed. The first is civil line of civil system of the laws and criminal system of the laws. Now, what is civil system and what is criminal system? Civil system, simply you understand, civil means some loss has incurred and you are fulfilling, or you are just making the patient by compensating the patient by giving the money. That is the civil system. And the criminal system is where the patient wants to punish the wrongdoer. That is through policemen. Like you are going in a car and you bang your car with somebody else's. The other person will have two concerns. The first is broken car, which he needs repair and he wants money to get it repaired. And second thing, he wants you to be behind the bar because you caused an accident. So the system which puts you behind the bar is a criminal law. For that, patient has to file a police complaint, and to get the money, patient will have to go to either civil court or a consumer court. There are two types of court. Basically, it is running for the civil system. So consumer court is practically, the fees is very minimal, sub 100 rupees or something patient will have to pay, and they can file case for 100 crore rupees. Like there is no limit. They can file anything as a compensation. So this type of cases they are filing. Now, as far as indemnity insurance is concerned, indemnity insurance means to make good for the losses. That means in a practice, if somebody files case against you and you have to pay X amount, say 50 lakhs, 60 lakhs, 1 crore, whatever. In that case, the insurance company will pay on your behalf. That is the system. That is the whole program. That is the indemnity insurance. So every doctor has to insure himself or herself from through this indemnity insurance company, unless that doctor is very rich. Like rich people don't require insurance. Ambani is not having insurance. He gets the scratch on the car, he changes the car. But otherwise, if you are like middle class like me, you require insurance and you must insure yourself for such kind of eventualities. So that is what is indemnity all about.
Yes, and also from my experience also that the premiums are not very high also for these.
We also have started indemnity because indemnity insurance companies are run through Bajaj Alliance, ICICI Lombard. These companies are giving insurance, but who will give you service? The people on panel or the lawyers on panel may not be practicing medico-legal advocates. They might
Right.
be fighting the different kind of cases. There are 10,000 laws. So there
Yes.
are Companies Act, there are Companies Act or international laws, or there are human rights commissions, or there are company laws, there are labor laws, there are family planning, family practice. There are so many different kinds of practice in law, criminal laws, just registration and trademark laws. Like people are dealing with different kinds of cases. Medical legal is a new field practically, and that is why you require some lawyers who are actually handling medical legal cases or they know something about the medicine. So for
Right.
that, we have started our own facilitation company where we are facilitating this insurance. So we are also taking insurance from either ICICI Lombard or Bajaj Alliance or any other company, but we are service provider. So we are like TPA in Mediclaim. So we will be giving the insurance through these companies and we will be handling the claim if at all it comes. So that is
Right.
what we are doing. And our team of advocate is only doctors and advocates who have converted into advocacy or those who are having very good knowledge of the medical field. So that type of team we have.
Yes. So then the question comes is what is it that the doctors have to critically not fault? What are the things that they must compulsorily, mandatorily follow to protect themselves, whether civil, criminal, either of these,
So
because most of the times it's unknowingly done wrong, and then you're into a difficult spot.
yes. So what we are talking about is negligence. See, the main ingredient, whether it is a civil case or criminal case, the main ingredient or main claim of the patient is negligence. Now, what is negligence? Negligence is defined as to do something which a prudent man in similar situation will not do, or not to do something which a prudent man in similar situation will do. Suppose a patient is having, say, A positive blood group and you transfuse her with B positive. You have done something which a prudent doctor will not do. So you are negligent for act of commission.
Right.
Now, there is second part of this definition is not to do something which a prudent man will do. Suppose patient in front of your eyes is sinking, her blood pressure or respiratory rate is going down from, or oxygen saturation is going down from 100 to 90 to 80 to 70 to 60 to 50. You can't let that patient die. You have to give oxygen, you have to give mechanical ventilation, you have to put her on ventilator, you have to shift her to the place where the services are available, treatment is available. Something you should do. So not to do something is also a negligence. So negligence includes activeness where your colleague would not have done that, actively doing something, or not doing something which you are where your colleague would have done something. So that is what is the negligence. Now, if negligence is of simple kind, a minor problem, then it will be falling into a category of a civil case. If it is gross negligence, like nobody is expected to do it. Like in our medical field, I can say that patient's left hand is fractured and right hand is amputated or treated. No doctor will do.
Yes.
That is a gross negligence. Or leaving mop inside after the operation, which that type of complications you will not find in the books. If that you have done, then it is falling into category of gross negligence that can attract even a criminal case. But to qualify in a civil case, a minor degree of negligence is enough. Also, we must understand the difference between the complication and negligence. All complications are not the result of negligence. Some complications do occur as a part of disease process or as a part of the procedure which you are doing. So all complications are not negligence. So that is what we have to keep in mind. Negligence, patient has to prove that this he should have done or this he should not have done. And if they succeed in that, they will get success in the court as well, and the court will pass order against the doctor.
So what are the safeguards again? We will talk of minor initially of
Yes.
negligences because in homeopathic practice, more chances that we will be facing more minor negligences rather than very gross ones because we don't are not into surgical aspect of it. But of course, there can be a situation, but the more day-to-day thing would be a minor negligence. So what are the safeguards against this? Because the perception of what is negligence from the patient's eye, like in the case that I told you that happened with me, and that of the from a legal standpoint of view would be quite different. So, what are the safeguards that we need to practice?
See, first of all, you have to practice in the field in which you are qualified. That is most important thing. The first ever case of Poonam Verma versus Dr. Ashwin Patel decided by the Supreme Court in late 90s was based on that. A homeopathic practitioner gave allopathic medicine, patient landed up into emergency. It was actually a different condition. Patient had diabetic ketoacidosis, which was not diagnosed, and it was considered as fever, simple fever, and some homeopathic medicines were given, and ultimately patient landed up in a and some allopathic medicines were also given. Yeah, and then patient landed up in ICU, and the charge also was not taken. Like the doctor was known to this patient, but still the complaint
Oh,
was filed, and they said that you have done something which you should not have done. And Supreme Court also ruled that the doctor who is qualified in homeopathy should not prescribe allopathic medicine, and that is called negligence per se, to do something knowingly which you are not entitled to do. So the Supreme Court gave this verdict that there is no cross-pathy practice allowed, and that was the first case, and that is even a criminal case. Like I had one incidence of homeopathic Ayurvedic doctor who one patient came and they tried to treat, and ultimately patient died of disease, and they were charged for murder because they were giving allopathic medicines to the patient and they were trying to treat the patient in Maharashtra. So these are all the incidences. So the first safeguard is always practice in the field in which you are expert. Never venture outside it. Whatever you have learned during your college days, that only you can practice. You can excel in that. You can enhance your skills, but don't cross the boundaries. That is the thing. So that is first thing. Second thing, communication is the key. more it is said that more you talk with the patient in the consultation room, less you will have to talk against them in the courtroom. That is the second dictum. So talk more, explain, always promise less and deliver more. That is the bottom line in today's life. Always promise less and deliver more. Never say you will be 100% fine. Never say you will be 100% okay. Never say it will go in 3 days. Always say it will take time. Yes, you say that 70% of the patient benefits, or you can say 100% of my patients have benefit up till now, but still I don't know. There is a possibility of failure. Always give guarded prognosis to the patient. And third thing, keep your documents proper. If your documents are proper, if your history taking, examination, or whatever medicines you have given, if all your records are clear, then I don't think you will have. And if certain things, if requires some kind of consent, where you are going to do something beyond, or the risk is more than than the benefit. Some medicines are like that. Some diseases are like that, where the risk is more, and patient may or patient should go to a allopathic practitioner rather than taking a homeopathy medicine. If you feel that in the best interest of the patient, this medicine is good, but still patient wants to take treatment from you, take a consent that this option was given to the patient, but patient wanted to take this treatment and hence the treatment started. Take their signature and keep such kind of consents. So that is also very important. Also,
Okay.
when male patient is examining a female patient, always keep some lady, either patient's relative or your staff, present in the consultation room. All these things you have to follow, and you will never have any medical legal problem. Or if at all there is a problem, you will have successful outcome.
So I think this is very, very important, especially uh, I wouldn't like to comment more on a lot of homeopaths who have been practicing uh, allopathic science. But when we come down to the documentation, I think a lot of our colleagues within the fraternity are very poorly documenting their cases. Dr. Bhatt, in the current era where we are talking about everything is becoming soft copies, EMRs, is there a kind of format in which you have to put it where it is a record, or can I make an own template of mine in a Word document or an Excel sheet and keep storing that?
See, uh, all the computers and softwares are can be used to make the document, not maintain the document. What you require is hard copy. We still believe in hard copy. What is acceptable is hard copy. All this electronic data is acceptable by the court unless if they have forensic laboratory certificate. So if there is a certificate from the forensic laboratory that there is no change or the data is as it is, then it will be accepted. Now what happens, sometimes you have typed something and you have changed it, but your system at the back end, it will put some
Well,
log that this is changed, that may be considered as forgery. That is why I always suggest that you take hard copy. Computer will help you make the record. Instead of writing, you type it, no problem. But keep hard copies ready. And whatever you give to the patient, you must have the same copy. Never try to forge it. Forging will be additional charge. It leads to 3 years of imprisonment if somebody tries to forge the document. So never forge the document. And in our field, like in allopathy, there is chief complaint, history, examination, provisional diagnosis, investigation, final diagnosis. This is the system we follow. Similarly, you also must be having that chief complaint, history,
yeah,
examination, something will be there. At least
yeah,
history will be more. Chief complaint will be there. There has to be some complaint from the patient side. That also we have to note down that what complaint patient has. Many a times we don't document the complaint. Then it looks that you have just started treating the patient because patient had come just for some other thing and you have started treating for this disease. He
right.
should complain for that particular thing. So you must document the complaint, the origin, duration, and progress of the complaint. And if examination is required, you have to get examination done. If you feel that this is emergency, and homeopathy, as far as I know or I understand, that it is not for urgent or emergency cases, like there is a severe cardiac pain and you require to do stenting, I don't think homeopathic medicine will work there. If it is that kind of situation, or patient is gasping, is
Yeah.
about to requires ventilator and oxygen, I don't think homeopathic medicine will help in that case. Even for allopathy, they have said that telemedicine is not to be done when such kind of emergency is there. Similarly, I also tell that if this kind of situations are there, not a chronic, something acute, you always give option to the patient of going to somewhere else or to the nearby allopathic practice place. So you have to identify the patient, you have to note down it, and you have to send the patient to a proper place with refer sheet, and make a note of that refer sheet also, or keep a copy of that with you as well.
That the patient has been referred.
Yeah, so whatever record you are giving to the patient, at least you also should have one copy of it or one mention of it in your records. Take negative consents. If patient doesn't want to go, patient don't want to follow
Yes.
something, then you have to take negative consent that this was advised, but patient do not want to do this. Take their signature. If they don't sign, at least you write down and take signature of two of your assistants that patient was asked to sign, but patient did not sign it. At least make that
Yes.
record. But something which is, and we allopaths have learned this thing about documentation very hard way. After paying crores of rupees for compensation, we have learned this thing that this is important. As far as your field is concerned, it is new. Like people now they are coming out to file case against homeopathy and Ayurvedic doctors. Please learn it from others' mistake. Don't try to have those things on you, and then you will learn. Right.
Yes. So, Dr. Bhatt, just continuing with this part of documentation, uh, so there are several of these electronic medical records that are available online. Now, do we have to look for some kind of a certification of these, or it would be good that we can create our own template, enter the data, take a printout of it?
You can do whatever you want to do, because whatever certificate they are giving, they are all certified by some private body. There is no government software existing. If
Right.
government software is not there, then it is considered as something which you have created. Only
Right.
thing is it should look and feel of that document should be as if you were making it during your college days. Whatever document you are making in your college, that is the standard and that you have to follow. So the output
Absolutely.
should be that whatever way they take data, they take treatment first, they take name afterwards, they take age in between, whatever. But when it comes as a printout, it has to be name, age, sex, address, like that. It should come out.
Yeah, the case record of the college that we used to fill
Yeah,
up
yeah.
when we were students.
Complaint history examination. That is how the record should come out.
Perfect, perfect. And also, would you advise that before we start the treatment, take down a written consent of the patient in the language of the patient? Would that be advisable, or it's not too much of a value?
We are taking OPD consent. Like I want to get examined by Dr. So and so. I am ready to give all the answers. The intimate questions may be asked. I am ready to answer the same. I don't mind getting examined in presence of male or female assistants or attendants or co-workers or whosoever. Like we have
Yes.
put all these things in our OPD consent, and we have created a consent, and that consent we are promoting. Also, I would like doctor to do the necessary test. I would like him to give the necessary treatment. I understand that all treatment will not have 100% benefit. There are some side effects, this, everything we have mentioned. So that type of
Right.
consent we must take, so that it is a proof that you, because when something goes wrong, they will say it was never told to me. What is the proof that you have told this? Only thing is what is written.
Yes, yes. Because like the case you said of the homeopath in the beginning, these
Mhm.
patients are already known to the doctor.
Yeah, they were staying in
Yet,
the same society. He did free service.
yes, and yet he had to pay up
Yes.
for this
At
kind
that
of an issue.
compensation with some 9% interest. It was around 10 lakh rupees in 90s.
90s. Yes. So, so I think so several areas we need to be careful of taking down the consent,
Mm.
where at even many junctures while in the treatment, we might have to take a consent negative consent also, that they don't want to take allopathic medication when they were recommended uh, by the homeopath, or they don't want to go for a test while it was recommended to them, because that's where we find a lot of resistance coming. Say where we tell them we need to get an MRI done or a sonography done, they said we don't want to get it done.
So you have to note down, and if at all it is very much necessary, then their signature is also necessary.
Right, right, right. And also, the other aspect that is happening more and more is this consultations, reporting, in spite of alerting our patients, communicating directly, is the WhatsApp and the online consultations that they insist. So, for example, if I were to share my experience with this online consultation, was these patients were following up with me for a long time. And then she had this fever of 104 for the last 2 or 3 days. And I told her that I do not understand your case and you will have to see me offline. And she was just staying around 500 meters from my clinic. And when I refused to see her online, they got really angry at me and saying, how could you do this in an emergency? So how do we navigate these issues? Because they are not only legal issues, but even clinical issues. What
See,
is the safeguard?
in medical council, they've come out with telemedicine guidelines. And in telemedicine guidelines, they have said two things. First, telemedicine, whenever you do, there has to be explicit consent. If patient starts telemedicine, then there is no consent required. But if you start telemedicine, then you have to take consent. Just patient has to speak that I am okay with telemedicine consultation. That confirms as a consent. Second
Okay,
thing, they have said all the videos or audios you have to preserve as a
okay,
record. That is second thing. Third thing, they have said it is not for emergency. If there is emergency, you immediately shut down telemedicine and tell patient to go to a nearby RMP. So your case falls into that category. Telemedicine is not for that as far as this medical council, our allopathic council is concerned.
yes, but I believe we can follow that.
That if there is no rule for you, at least you can show something which is similar. So,
Yes.
and the last thing, even in telemedicine, they have said if there is a need in a cool case, forget emergency, there is a need to examine the patient, you have to put proper diagnosis and then only treatment should be started. So, I cannot say as a defense, in a defense, that since it was telemedicine, I could not diagnose. That is why I had given wrong treatment. That is
Yes.
not the correct statement from my side. Either I should be able to diagnose 100%, or I insist the patient to come to me and to get it checked. So you cannot take telemedicine as a defense also, and you should record everything. You have to take patient's identity. You have to show your identity. Identity exchange is also required, because who is consulting you online, you also don't know. So you have to take their identity proof. You have to give your identity proof, your consultation fees you have to declare, and you have to give prescription. Also give prescription in such a way which is in a JPEG format or something. That is what I recommend, because there are cases where word format prescription was given and patient changed it. Like some
Okay.
psych drugs, doctor has prescribed for 15 days and he made it 45 days because he had that addiction.
Correct.
So all these things can happen on online. So we have to be very, very careful. Also, I suggest that in prescription you write, don't give this medicine if prescription is more than 15 days old. And I put the date. So if date is more than 15 days old, this prescription should not be honored. Like that, you have to put all these caveats in our prescriptions.
Okay. Okay. And what do we do, Dr. Bhatt, with this WhatsApp? It's truly becoming a headache from purely medical standpoint of view also, let alone the legal part of it.
So
And
it is.
patients are not willing to budge, because I remember one of my patients sending me a message at 2 o'clock saying that 105 fever her child has got, and the next morning she calls me up and she's mad at me saying that you don't care about your patients, you're negligent.
Hmm.
So how do we go about with this? And I
But
believe a lot of our colleagues are facing this.
yeah. First of all, you just put your in your, if at all you don't want to do this, you can put that notice board in your clinic, as well as every prescription should carry that message that we don't consult over a WhatsApp. And it is perfectly fine. It is your right how to consult. They cannot dictate you how to consult. So you say that we don't consult over a WhatsApp, kindly come in person, or in emergency make a call and then follow the instruction. So they may call you and they may follow the instruction. Your instruction may be to come and see, or your
Right.
instruction may be to go to some allopath. Right.
Right.
Always make this very clear. And court will also not insist that you should consult over a WhatsApp, because WhatsApp is a social media. It is not a medium for professional consultations.
Absolutely. Absolutely. So I think at least we make it a point, even at the first consultation, stating in written very clearly to them that do not report, do not consult over WhatsApp. I think that is the only way.
Your prescription bottom line should be, we don't consult over a WhatsApp. Just
Right.
put that line and it is good.
Right. And one last thing before we end up this very, very meaningful dialogue is the social media use. There have been some talks about restriction on the social media, uh, what we can put in, what we cannot put in. So if you could just help us understand that.
See, both the councils are same. The Council Act are silent on the social media, but they are telling explicitly on the advertisement. What the councils say, that a doctor should not advertise on any medium or lay press, that you can't do. You can advertise in press only in following situations: when you start a new clinic, or you change the place, or you change the type of diseases which you are treating. For those things, or your absence from the duty, you resume your duty, you have gone for vacation, you come back from vacation, you want to advertise. That type of advertise is allowed. Photograph is not allowed. You cannot put your photograph in any of the advertisement. You cannot endorse any product, and you cannot ask your patients to give something in your behalf. It should not look like advertisement. Like, patient cannot say that Dr. Munjal is very good and you can't lure the patients, new patients, through such things. So all these things
Right.
are restricted, and it will be considered as misconduct as far as the medical councils are concerned. And
Yes.
medical council has power to remove your name for various period. Council has only that much power. It will not ask you to pay money, or it will not hang you. What council can do, they can intimidate you by one letter that henceforth don't do this, or they may remove your name as a punishment for 1 week, 15 days, 1 month, 3 month, 5 month, as per the decision of the committee.
Okay. Right. So I think this is very important. And since all of us or most of us are on social media, we better be careful so that we don't get into trouble, and we do not want to kind of spoil the name of our
Both the,
fraternity.
both the councils have allowed for public health. Like, you can give lectures for public health. You can do activity for public health. So there is a
Yes.
thin line between public health awareness program or an advertisement. If
Right.
I say that I am doing this surgery for fibroid, whether I am advertising myself or I am giving knowledge to the patient, it is at the discretion and wisdom of the committee which is handling your case.
Yes. So it's a gray area also, which.
Line. It is not a gray area, it is thin line, and your intention will speak about it. Like, if you are really, you have that thing to advertise, you will present it in such a way that it will look like advertisement. And when it looks like advertisement, the committee may take decision that it is advertisement and it is not purely a healthcare concern. So you
Yes.
have to be very aware. You can do healthcare program. You just conduct healthcare program. You make them aware about the things. You make them aware about the diseases. You make them aware about the alternate medicines. No problem. But it should not
Yeah.
look as if you are advertising for yourself. It should be for the community's benefit.
Right. Right. So I think this has been extremely helpful dialogue. we can go into a lot of details in a lot of areas, but I think for today, this is good. And last word for you, Dr. Bhatt, and any resources that you have for all of us to access this kind of information, and how we can reach out to you for more of such information, advice.
So the most important thing is I will put the number on the or if suppose you want like insurance, we have got it passed through our companies for Ayush insurance for Ayush. So we are also
Okay.
now providing insurance for Ayush. The premium is hardly around 5,000 rupees or something for 1 crore rupees insurance for 1 year.
Right.
So somebody is interested, they can take it. Only thing is, it will cover only if you are practicing in your field. If you are
Absolutely.
practicing in allopathy, then that insurance, it is negligence per se, and insurance company will not provide any protection in that case.
Yes. But I think for a lot of us who are actually practicing homeopathy, it's going to be of lot of help.
Yes.
And any other resources that you know give us.
Uh, And like we or our team is there for any issue, any question. If you have anything, we are always available. And
Yes.
professionally, we work for that and we sort out the problems.
And how can we reach out to your team?
It's my number you can have like nine eight double
Yes.
three nine double six five
So
double
that
two.
we'll put it up in the
And
write-up. Yes. And any other website or anything where we can reach out to
yeah,
you?
I will send that to you. It is
Sure.
medicolegal.com, our website, our company's website.
Sure.
We have
Okay.
some questions in the chat. Do we want to take them?
I think most of them have been taken up, Dr. Keyur.
Uh,
Uh,
okay, I
Yeah,
did
I
have
think
one
most of them have been
question.
taken up, and we have had a good enough time for Dr. Bhatt on a Sunday, so I think we should end here.
First question they ask, can we prescribe a multivitamin and paracetamol? See, these drugs are OTC drugs. There is something called OTC. Drug Act has a schedules, various schedules. So one schedule is the OTC drug, that is over-the-counter drug. So over-the-counter drug, even you patient don't require your prescription. Patient themselves can ask for it, and the counter person has to give. So paracetamol and multivitamin falls into that category. So that can be prescribed, not a problem.
Yes, yes, yes. So I think most other questions have been answered.
Therapeutic dose, then you can't. If it falls into some schedule like Schedule C, Schedule H, Schedule
Yeah,
H, then you can't prescribe. But over-the-counter medicines can be prescribed.
yes, yes, yes. Right. So thank you, Dr. Bhatt, for this absolutely insightful talk. We will keep engaging with you, and I'm sure you're going to have a lot of queries from our fraternity. And this
Very
is
well.
very nice what you have spoken, and we will do take care of ourselves from here. Thank you so much.
Yes, sir.
And
Thank you.
yes.
Munjal sir, I request you to stop the stream.
Yes, I'm stopping. So we can end the meeting now.
No, sir, first stop the stream.
I've stopped the recording. Now what?
No,
I've
no, stream, the
from
thing,
the
live
stream.
stream.
Okay, okay, okay.
Just let me make sure it has stopped, otherwise it will keep on